Welcome back to our educational video series. If you're watching this video, that means that you've likely scheduled surgery now and you're getting ready for moving forward with it and looking forward to that surgery date. Typically, I find that when patients hit this point, you stop thinking about things from a long-term perspective and you start thinking about things from a short-term perspective. And by that, I mean, rather than thinking about what you're going to get back to after you've fully recovered from surgery, you're thinking, wait a second, this is going to hurt. What are we going to do about that? And you're largely going to be focused on pain control. And so I want to touch on that a bunch in this video. But the number one thing that I want you to hear is that after surgery, the pain will get better every single day. You can see here a graph where they monitor a patient's pain levels throughout the day in their recovery from surgery after a knee replacement, and you can see that it gets better every day. So if we can just focus on that and manage your pain as best we can today, we can also know that it's going to be better tomorrow and it's going to be better the day after that. And we're just taking it a day at a time, trying to keep you as comfortable as we can, knowing that there are better days ahead. And the reason that we want you to think about it this way is that there's a difference between pain and nociception. Nociception is the actual physical sensation that is causing you discomfort. As you recover from surgery, the thing that's causing the nociception is me. I caused some bodily damage to you in the process of doing your surgery. But pain is how you emotionally and cognitively process that physical sensation. And if you cognitively process it by saying, I just had a joint replacement and I can feel where I had that. It doesn't feel good, but I'm okay. It's supposed to feel this way. I'm supposed to have some discomfort. And if I give my body time to heal, that discomfort will be temporary and it will go away. What will actually happen is you'll have less pain because the cognitive processing will result in you viewing it as something that's normal instead of something that's abnormal. And that will allow you to take less opioids. And the patients who take less opioids actually have less pain. And so it's all a part of the bigger process. The first thing that I'll do to try to control your pain after your knee replacement is inject medications into the knee to try to make it so that you're coming out of the surgery with medications loaded into the knee itself. And here you can see all the locations that we know have nerves around the knee. And I try to hit all of those with a cocktail of medications that includes anti-inflammatories and numbing medications so that when you wake up, we've already loaded up your knee joint with a bunch of medications to try to proactively manage your pain. As you're recovering from your joint replacement, far and away, the most important thing you can do for pain control, and it's not even close, is ice. Icing is the only thing you can do that will make it so the area where you just had surgery isn't being sensed. It will actually cause you to get numb in that area. It will also help to limit the swelling. And so I think there's almost no limit to how much benefit icing can have for you. The only time when I would say you've done it too much is if you give yourself frostbite. The best way to do the icing from a logistic perspective is to get an ice machine that pumps the ice water into a pad that you then put directly on your surgical site. And in order to keep that water cold, the best way to do that, rather than just dumping ice cubes into it over and over again, is to take water bottles, put them in the freezer, and then drop the water bottle into the water within the ice chamber so that you can just refreeze those water bottles over and over again. I definitely want you to get one of these ice machines as you get ready for surgery, and it's something that our clinic can help coordinate for you so that we can make sure that you have one if it's not something that you have already. The next thing that we use to try to control your pain as you recover from surgery is medications. And by these, I do not mean what we would traditionally refer to as painkillers, which is opioids. I mean anti-inflammatories and Tylenol. These are incredibly effective medications. There's a reason why we use them for so many different types of pain that we have in everyday life. And I want you to use them in your recovery from surgery, initially, regardless of whether or not you're having pain. I want you to take them on a scheduled basis so that we are getting some medications in your system to try and keep you comfortable. Most often after a surgery, I'll prescribe meloxicam, which is a once-a-day anti-inflammatory. However, if you find that some other anti-inflammatory, such as ibuprofen, Aleve, or Celebrex, works better for you, then we can use those instead. For some patients, we can't use anti-inflammatories because of kidney or stomach issues. And if that's your situation, we can talk about strategies that we can use in lieu of those anti-inflammatories. Another medication is Tylenol. Again, people kind of think Tylenol is available over the counter. I take it for headaches. I give it to my kids. It's a very effective medication. And it works differently than anti-inflammatories, so you can take the two of them together. I want you to be taking 3 grams of Tylenol per day. That's a lot of Tylenol, or 3,000 milligrams. So what that would mean is that if you have Tylenols that come in 500 milligram capsules, which is generally the dosage they come in, you would be taking 2 of those 3 times a day. So with breakfast, lunch, and dinner, you would take 2 Tylenol. That way we're getting the maximum amount of Tylenol in your system that is safe. And we've got the anti-inflammatories and the Tylenol trying to control your pain from a medical perspective. Now, the last thing that we have as a component of your pain control regimen, and I have very pointedly talked about this last to emphasize how many other better tools we have for pain control, are opioids. Generally, the one that I prescribe post-operatively is oxycodone. I don't want you to take any of this, but we're putting it there as an option that you have so that if you're having breakthrough pain that is not controlled with all the other things that we're trying to use, you have it available to you as a bailout. So we're all familiar with the addictive potential of opioids. And I think a lot of people assume that that's the only concern that we have with these medications, is that they treat your pain really well, but you can also get hooked on them. And that's not actually the case. Even if these weren't potentially addictive, I still wouldn't want you to use them. There's some really, really severe side effects associated with them. And as it relates to pain, one of the most significant ones is called opioid-induced hyperalgesia. And this is a mouthful, but what it means is that as you take opioids on a chronic basis, you actually become more sensitive to pain, including the pain that you were taking it for in the first place. And so if we're chasing your pain with opioids over time, not only is there the potential that you'll get addicted to them, but there's also the reality that we're going to potentiate your pain, or we're going to actually make your pain worse and make you dependent on them at higher and higher doses for the same level of pain control. And that's exactly how people end up in the situation of getting addicted to these things. So the best way to avoid addiction, and the best way to avoid this increased pain associated with taking them, is to not take them, is to use the things that we've talked about previously in this video: ice, anti-inflammatories, Tylenol, patience, in order to deal with this pain while you're recovering, and move forward without these medications, with the other strategies that honestly are more effective anyways. Now, there are some major issues associated with opioids, and I think it's important to acknowledge those. Here you can see the chemical formula of oxycodone, which is the medication that I prescribe as a breakthrough pain medication after surgery, compared to heroin. And they're not very different. And I think this is something that we don't educate people well enough about. These are dangerous medications, and there is a very real addictive potential to them, which is why I think it's so important to use as few as you possibly can. However, even if they weren't addictive, there are some other major consequences associated with using opioids. Lightheadedness, nausea, vomiting, or constipation. And in fact, the constipation is so severe that I'm going to play for you in a moment a commercial that aired during the Super Bowl for a medication that is just to deal with the constipation caused by opioids.
If you need an opioid to manage your chronic pain, you may be so constipated. It feels like everyone can go, except you. Tried many things, still struggling to find relief? You may have opioid-induced constipation, OIC. It's different and may need a different approach. Opioids block pain signals, but can also block activity in the bowel, which is why it can feel like your opioid pain med is slowing your insides to a crawl. Longing for a change? Have the conversation.
This is the level of overuse of opioids that we have in our country. And this is the severity of the constipation that can be caused by them, that somebody out there was able to fund a Super Bowl commercial, and we all know how expensive it is to get a commercial on the air during the Super Bowl, just to advertise ways that you can deal with the constipation associated with taking these medications. That's completely disregarding the fact that you can get addicted to them and they can ruin your life. So again, use your other pain control methods to try to manage your pain as you're recovering from your surgery, and don't reach for that one primarily. If you can use none of it at all, that's even better. And I referenced using none at all because one of the areas where I trained during my residency in Charlotte, North Carolina, I was involved in conducting a trial where we took patients through surgery without using any opioids at all. And here you can see the results from that trial, that the patients who went through surgery without taking any opioids did just as well. And I can tell you from my experience of having been involved in that trial and having visited with those patients in the hospital or in the clinic after their surgery, they didn't just do as well. They actually did better because the side effects from opioids are so significant that any pain control benefit you may get from them is kind of a robbing Peter to pay Paul situation, where you're also dealing with the lightheadedness, the fatigue, the GI issues, and overall, you're probably better off without them than you are with them. So if we can get you comfortable enough to tolerate the levels of pain that you have using all of the other strategies that we can come up with, your recovery will be better than if you're relying on opioids for your pain control. There's a national challenge underway that I'm participating in related to opioid management after hip replacement and knee replacements, because like many other surgeons, I recognize that this is a challenging process to recover from, but also that there's a risk associated with taking these medications. And so if you are able to recover from your hip replacement or your knee replacement, taking 10 opioid pills or less, I want you to go on March to a Million, which we are going to include a video from here in a second explaining this, and share your story. Share with other patients how you were able to do this, what steps you were able to take to control your pain that didn't involve opioids, and celebrate that success, because that's a big achievement and it's something that you should be proud of.
Hi, it's Dr. Wickline. It's April 2025 and we have officially launched the March to a Million Low Opioid Total Knee and Total Hip campaign. Just 2 months ago, I saw an article that suggested that the average patient needs over 100 oxycodone to get through one of these surgeries. That's absolutely crazy. We all know what these medicines have done to our country. Many states are still in the throes of this problem. It's time to make a difference. It's time for you and I to be part of something bigger. Yes, knee and hip replacement can be challenging, but it can be done with 10 pills or less, many times no opioids. So I'm really encouraged that you found our website. I encourage you to sign in. Tell the rest of the world that you were able to do it in 10 pills or less. Tell the rest of the world who your surgeon was that was able to help you get through this operation with a better recovery and lower risk. Thank you so much for being part of this very important movement. It's time to get these drugs off the street. It's time to take back America. Thank you.
There are a lot of logistics that go into planning your surgery. And I have a whole team that participates in this. And I'm actually going to introduce here one of the members of the team, who's one of our physician assistants. Physician assistants play a huge role in the process of a successful surgery. And you're going to meet them throughout this process. The pre-operative visit will be with one of the PAs. And I like to have that visit with them because if I see you right before your surgery, I'm a surgeon and I'm going to be thinking about how to do the surgery. Whereas the PA is going to approach it with a different perspective. They're very valued members of our team. They have advanced degrees beyond a college degree, and they have years of experience in orthopedics, so that they can look at your surgery as a whole and make sure that they're identifying any potential issues that might pop up and ironing out all of the details of a plan that's specific to you. So they'll go through your medications. They'll go through the logistics of preparing for surgery, what to do in the week before surgery. They'll be with me during the surgery and they'll close the wound, put on the final dressings. They'll see you after surgery to make sure that everything is squared away before you go home. And then if any issues come up after surgery, they'll be a part of making sure that we're managing those appropriately. So I'm going to introduce one of them here in a moment, Sierra Klein, and she's going to go through what that preoperative visit will look like, as well as what's going to happen for you as we prepare for you to transition back home, and then moving from management in the hospital here at Island Hospital to management in the clinic as you're recovering at home.
Hi, I'm Sierra. I'm one of the PAs here at Island Orthopedics, and I routinely see people for their preoperative appointments, and at that time we'll discuss your postoperative pain medication and coordination of care for after surgery. So prior to surgery, we'll have you do a HIPAA wash for 5 days, including the morning of surgery. This is to reduce the bacterial load on your skin prior to surgery, lower your risk of infection. And then after surgery, I do prescribe either oxycodone or tramadol for postoperative pain control, but we want to use that as a last resort. Primarily want to focus on anti-inflammatories, Tylenol, and ice as your baseline pain control after surgery. Other prescriptions that I often send after surgery would be ondansetron, which helps with nausea, colace for constipation, and sometimes I'll send something for muscle spasms if that's an issue for you. So we'll talk about all of that in depth in your preoperative visit. We'll also talk about the current medications that you take and when you need to discontinue those prior to surgery. And key things that we want you to tell us at the preoperative appointment are if you've had a history of any blood clots or pulmonary embolisms, if you currently take anticoagulants, if you have any major cardiac or respiratory disease, so that we can appropriately work you up and make sure you're stable prior to surgery. So after surgery, to prevent you from getting a blood clot, we'll use some form of DVT prophylaxis. Most patients can take aspirin twice a day for a month after surgery, and that's adequate. If you have other existing health conditions or you already take anticoagulant medication, we'll coordinate with your cardiologist or prescribing provider to create a plan for you specifically. Other things we'll talk about at your pre-op visit is coordinating your postoperative physical therapy. We generally want people to start physical therapy about 10 days after surgery. And if you haven't had a referral by the time you see me, I'll send one at that time, and we want you to get it scheduled as soon as possible because physical therapy offices can often get booked out for several weeks. We also will talk about what to expect in the hospital. We generally want people to go home the same day. We do everything possible to get you home if that's safe. Before we send you home from the hospital, we want to make sure that you're peeing and your pain is well controlled. We'll also have physical therapists come and work with you, make sure that you're able to walk and get around safely before sending you home. It's important that whoever your caregiver will be at home is present with you in the hospital during your physical therapy session, because the therapists like to work with them on what we call caregiver training and so that they're trained on how to best support you with getting around the house, getting to the bathroom, getting up and out of bed. And so that can really help facilitate a faster discharge after surgery if you can have your family member or caregiver present with you at the time of the physical therapy. One of the PAs will come by and see you every morning while you're in the hospital to keep checking on you, make sure that you're progressing well after surgery. We'll make sure that everything's ready for you before you discharge home and that you are stable enough to be safe at home prior to discharge. Once you are discharged home, if you have any questions or concerns, our team's available to you 24 hours a day. Someone will get back to you. Oftentimes, your 2-week post-operative appointment will be with a PA where we'll take a look at your wound, make sure it's healing well, take out any sutures if necessary. We'll make sure your pain is well managed and there's no concerning findings. We'll oftentimes get x-rays at this appointment as well to make sure the hardware is in good alignment and everything's healing appropriately. And then you'll have another follow-up appointment at 6 weeks, usually with your surgeon.
Hey, I'm Dr. Carter. I'm one of the anesthesiologists at Island Hospital. I'm going to talk to you briefly about the role of the anesthesiologist during surgery and what's important about preparing for surgery. First of all, the anesthesiologist is the medical specialist taking care of you in the operating room. Our job is to provide anesthesia, provide pain control, and monitor your body's vital functions. We're at the head of the bed continuously during surgery. We're looking at things like your heart rate, blood pressure, oxygen saturation, your breathing, as well as your body's response to the surgery, and we're responding accordingly throughout the case. In essence, we're there to keep you safe and comfortable during your surgery. So it's important to think about the day of surgery as game day, or like a cross-country trip. You don't just hop in your car and go. You check the tire pressure, you top off all the fluids and make sure everything's ready to go before you head out across the country. Want you to have the same frame of mind coming into surgery. This is important for several reasons. First of all, surgery inherently carries risk, and our goal is to minimize all the risk factors that the patient may bring to the table prior to coming in for surgery. Conditions such as heart, lung, and kidney disease can increase your risk of complications after surgery and could also interfere with the healing process. And second, if there are conditions that are poorly controlled or discovered on the day of surgery, such as a severely elevated blood pressure or severely elevated blood sugar, your surgery may be postponed and we might have to reschedule. If you have any questions about anesthesia or would like to speak with an anesthesia provider, reach out through your surgeon's office and one of us will be happy to talk with you before your case.
Hi, my name is Christina Hinchy. I'm a certified registered nurse anesthetist. For your total joint surgery at Island Health, we implement multimodal anesthesia. Multimodal anesthesia combines different medications and anesthetic techniques to decrease postoperative pain, postoperative nausea, vomiting, and enhance recovery, allowing for more rapid ambulation and physical therapy. Beginning in the preoperative holding area, we will administer different medications to help decrease postoperative nausea, vomiting, and postoperative pain. For surgery, there are 2 different types of anesthetic techniques. The first is a spinal anesthetic. A spinal anesthetic is the preferred anesthesia for a total joint replacement because studies show that it decreases blood loss, decreases the risk of blood clots, and provides optimal intraoperative and postoperative pain control. For a spinal anesthetic, we'll go back to the OR, get you hooked up to the monitors, moved over to the bed. We'll assist you with the correct positioning, clean off your back the same way they do for surgery itself, inject a little bit of numbing medication in your lower back, similar to what they do at the dentist. After that, you can expect to feel a little bit of pressure, and we will use a small needle to inject a little bit of numbing medication in your lower back. The numbing medication will last for about 2 to 3 hours, and you will be numb from about the hips to the feet. After that, we'll lay you back down flat and give you some sedation so you sleep throughout the surgery. Before the surgery is over, your orthopedic surgeon will inject some numbing medication to help decrease postoperative pain in the surgical site itself. Or that's not enough, we can use an ultrasound to inject numbing medication around the nerve that feeds the surgical site to help decrease postoperative pain. If a spinal is unable to be performed, we will do general anesthesia. General anesthesia provides a controlled unconsciousness, so that way you do not hear anything, you do not feel anything, and you do not remember anything. Before the surgery is over, the orthopedic surgeon will inject numbing medication in the surgical site to help decrease your postoperative pain. If that's not enough, we can also inject numbing medication around the nerve that feeds the surgical site itself. When it's over, we will wake you back up and bring you to recovery. In recovery, common side effects of general anesthesia include a sore throat and nausea. We do have medications prescribed in the recovery room to help decrease nausea and pain.
We'll have to figure out with you as we're working through your day of surgery is whether you go home the same day or stay at the hospital overnight. And I think there is a huge benefit to going home, and that is your ability to sleep in your own bed. If you're at home, we will have you in your own environment that you're used to. There won't be anybody waking you up. And we actually know from a study just south of here from the University of Washington that the day of surgery, people get more sleep if they're in their own bed at home than if they're in the hospital. And so all else being equal, my preference for everybody who goes through surgery with me is that the night of surgery, you spend the night in your own bed. Now, obviously, there's a lot of individual patient factors that go into play with this. But if at all possible, that's our goal for you so that we can get you a good night's rest and start you on the recovery process in your own home environment.